are live. Hey guys, what's happening? What's happening? It's a little quieter right now, so we can pop and say hello to you guys and share some information. Let's see who is watching. Let's see if I can flip the camera. So Dr. Guy Arad here at the RAPS Animal Hospital, Richmond, BC. So if you guys are watching live, you can drop me 1 in the comments. If you guys are watching the replay, you can drop me 2 in the comments. Let's see if I can find us a room. So just using this little break that we have to share some information, mostly about big dog lameness, kind of little known facts that most people don't really know. When is the best time to take your doggy to the vet before it's really bad, and things like that. But you know what, guys, let's see if I can find us a quiet room. Okay, just a sec. Alrighty. Hey guys, welcome to the live. Let's see if we can pop into this room for a sec. Stephanie, how are you doing? Good to see you here. Thanks for watching. Alrighty. Let's see if I can flip the screen here. Here we are. I'll give it to Wendy. She's my cameraman. So, guys, I wanted to take a couple of minutes and share some information, about big dogs, especially when they're limping. What's the reason, and especially, kind of couple of facts that are really little known, most people will never know about. So, we see a lot of cases, and I've been helping a lot of big dogs and little dogs, and fixing knees of dogs for the last 7 years, being in the profession for now 16 years. But this is specifically for you guys that mostly own big dogs, okay? So you're probably familiar, if your dog is limping, you're taking it to the vet, and maybe they diagnose it with a torn ACL ligament, right? So most of us, just like, from people, we are thinking about, okay, so my doggy blew the ACL, he was running really fast, he was turning around, right? And then he started limping and he blew his ACL. So you guys, unlike people, right? For us humans, it's mostly kind of an athletic injury. We go ski, we play soccer, and we hurt a knee and an ACL. This is more like athletic injury. In the dog, however, and I'm talking mostly big dogs, over 15 kilograms, over 30 pound body weight, it's completely different. It's completely different. And in the dog, and you'll see why in a minute, it's more like a degenerative disease. And unfortunately, if you own a big dog, it will happen. It's just a question of when it will happen. So with what I'm going to share with you, hopefully you'll have the tools and understanding to detect that on time, when it's not too late, when your dog is not in severe pain, and we can actually reverse and fix the situation pretty quickly. Sounds good? So I'm going to show you a little bit about the canine knee. So the main difference, this is the thigh bone, and this is the tibia bone below the knee here. So for us people, this kind of slope does not exist, and it's completely leveled. That's why in humans, in people, when we hurt our ACL, which is the main ligament inside the knee joint connecting the two bones, it's athletic injury. But in the dog, there is a slope. So you can see this slope, right, of the tibia bone, and what happens is the thigh bone is sliding backwards. So if you guys kind of imagine maybe like a cart, it will be going down the hill, right, because of this slope. And the ACL ligament, we can see it on the x-ray, but it's actually in front of it. So there is continuous wear and tear on the ligament because of this reason. I remember when I took the course how to fix that like 8 years ago with the American College of Veterinary Surgeons, and one of the guys and one of the surgeons was kind of joking that, you know, when God was sitting and designing the knees of our big dogs, he was consumed with something else. Maybe he was stoned, who knows. But all of our big dogs, you guys, they have this slope to a certain extent, and that's why it's really, really, really important to recognize that on time before it's too late. So what are the first signs? Obviously, if your dog is not weight-bearing, that's bad, right? It's severe, right? So, but I'm going to kind of get you to develop the eye for something that will help you, especially if you own a big dog, to know what's happening. So most big dogs, when they're just starting to have any issues with the ACL or the cartilages in the knee, usually you will see that if the dog is jumping off the bed or the couch and it was, you know, maybe sleeping or resting for some time, it will be kind of, it look like the leg is numb. It's like sleepy for maybe a second, maybe 5 seconds. And guys, this can be kind of, you know, even twice a week, maybe even once a week. Usually, guys, if there is, obviously there are a lot of other diseases, you know, and orthopedic conditions affecting the hip and the hocks and a lot of other things. But usually in the big dog that doesn't have a bone cancer, doesn't have hip issues, hip dysplasia, or anything like that, this can be the very first sign that your doggy has ACL problem. Because this problem in the dog can go undiagnosed for months and years, now we call it ACL disease. You see, guys, so it's very different from the human knee, where you go, you play soccer, oh my God, I need ACL surgery, right? So it can go, it can be a disease, the dog will develop arthritis and pain and suffering, and when we fix that, then, you know, sometimes we can be too late, right? So if you see that your dog is jumping off the bed and, you know, any particular leg is sleepy, is numb, maybe for 2 seconds, maybe for 10 seconds, and then everything seems okay, and you kind of see it once a week, twice a week, every week, this is the very first sign that you have to take your dog to the vet and kind of screen. Obviously, you're looking for, you know, clinics and vets that they do a lot of orthopedic surgery, especially on knees and TTAs and TPLOs and whatnot. This is the first sign you have to take your doggy to the vet rather than wait that it's not weight bearing, and it's not your fault. A lot of clients come to us, oh, I was running with my dog, maybe, you know, I caused it because it was too hard and blah blah, and no, it's not the case. They're predisposed for that, and that's the exact reason, this slope that is causing, and this is the most common injury of the canine knee, over 15 kilograms or 30 pounds of body weight, right? So how do we fix that? So what we do usually, we go into the knee joint, we clean everything, we debride the ACL, sometimes we have to clean the menisci, the cartilages, and then we perform, you know, either TPLO or TTA. We're actually changing the dynamic and eliminating this slope that I showed you, and now you can see the knee is leveled, and now the dog is going to engage the muscles in a completely different way. And by the time this is done and it's healing, you know, the dog is back to normal activity. Usually, you know, it's a commitment for like 12 weeks. So that's kind of in a nutshell, and the truth about ACL disease in the dog, and definitely not your fault. You know, your big dog is predisposed to it, so now you know what to look for. So just to recap, if your big doggy, you know, it can be young. Some dogs we see, like, you know, they're just a year old, and some dogs it happens when they're 10, 11. But when the leg, one particular leg, hind leg, is sleepy, is numb, and even if it's 2 seconds, 5 seconds, and it's kind of repetitive, and you see it over and over again, that's the time that you have to take your dog and obviously look for a clinic that they have experience and they have a track record in doing this procedure, so that they do it on a weekly basis. And yeah, that's what I have for you guys today. So hopefully you remember that. Feel free to share the love, and you know, if this tip, you know, someone has a big dog and this can be of value, you can share obviously this live Facebook and information. You have a link if you want to kind of book with us online and you live in the area. I would love to see you guys. But yeah, thank you so much for stopping by. Guy Arad here. with the RAPS Animal Hospital, and we will start and share some more information and go in between vets and team as well, and pop here now and then. I don't promise anything, but kind of give you some value and education and how to do things with your dogs and cats. So thank you guys. I'll see you in the next video.